So we have the diagnosis of ape hand median nerve injury. And so what that is a low laceration or low median nerve injury, also known as ape hand. This is usually caused by a deep injury to the wrist, forearm, or arm area. And motor, sensory, and sometimes even vascular structures can be affected distal to the injury depending on how extreme it is. And with this injury, it's primarily shows wasting of the thenar eminence, and there will be no palmar abduction. And so the clinical presentation is again wasting of the thenar eminence, loss of thumb opposition and palmar abduction, loss of thumb MP flexion, and sensation to the volar radial aspect of the hand.
Alright, so for ape hand, we chose to create a C-bar splint. So how this works is that it goes on your thumb and on your index finger to try to open up that web space. So it also helps to prevent the soft tissue contracture in the first web space, and also helps to improve the functional use by positioning it more in like this, the thumb in more functional position. So for this C-bar splint, we see this here, and it has these straps. And you wave it around.
And you can see how she's in like a functional, without splitting the last 3 digits, she's in a functional hand position, and we bring that thumb into some abduction, and we also create some web space to kind of just give some muscular re-education, kind of bring it back, and that also allows for median nerve regeneration.
Yes, and it still allows the person to be able to use these fingers and be able to flex and extend their wrist without any issues.
And in the clinic, whenever we would, because it's if you can tell, it's kind of like some odd strapping. So what we would do is we would just use like teach back method and allow them to put the splint on and off multiple times to make sure they know how to don and doff the splint at home by themselves. And we have the strapping on the inside of the splint up here and right attached close to the finger, to the thumb, just so we can make sure that is stabilized where it needs to be at the thenar eminence.
Yes. And so as part of something that the client will take home following the session, we have created not only a home exercise plan, but also a caring sheet, or a sheet to that instructs the patient on how to care for their splint. So when to wear it, how to clean it, situations of when to take it off if it's causing too much pain or things like that. So they know what to expect with this splint.
And in case they forget, and sometimes being in therapy is overwhelming, so they need a reference sheet. And we also have going home with them in home exercise program. But today we're going to show specific techniques and treatments that we would use in a treatment session. Okay, so at the beginning of the treatment session, when our client comes in, they'll be, of course, hopefully wearing the splint that we made them, and we will just take it off and look at how they have been wearing it and make sure they don't have any skin breakdown. Notice that she has she doesn't have any redness. Of course she has not an ape hand, but still no redness. Did it cut you or anything while you're wearing it?
No.
Great. And so we'll kind of do like a skin check, and that may take like 5 or 6 minutes of just talking to our client and making sure they're wearing it right, and making sure they're wearing it at night, and just looking at pain levels and giving them the scale to use to objectively analyze their pain.
After that, we could also do, just for preparatory, we could, just for preparation in order to start the therapy session, we could use PAMS, specifically electrical muscle stimulation. It's often recommended just with the goal of minimizing muscle degeneration, and since with the Ape Hand, we do have some thinner wasting. That would be a great thing to use just in order to help prevent that further from happening, and also maintaining the muscle fiber integrity. And it could also help with the pain that the patient may be experiencing.
Mm-hmm. Okay, so for some actual treatment techniques that we're going to use is we have this block stress ball, we have this black round stress ball, and then we have this foam block. So we're going to put this one to the side right now. We're going to use this as a stabilizer because we do have a median nerve injury, and this is what we're going to actually use. So we're going to place the wrist on here, and this just provides some stabilization, and we're going to use a 3-jaw chuck type of grasp. And we know that our last 2 fingers are stabilization fingers, so we're going to place them kind of underneath and just give us a little bit more stability with the block because we're still working with an injury. And so what we're going to do is we're going to do some isometric exercises with this foam. And this is a very easily pinched foam. It's very light in grade. And so what we're going to do is squeeze this and hold this down for at least 5 seconds. And with this, the benefit of it is that it can be turned into an easy goal. So client will maintain the squeeze for 5 seconds to build up strength, but in preparation for brushing their teeth or like maybe home management as far as like meal prep and, you know, grasping something to cook with.
Mm-hmm. And we said the key thing, you know, because that uses that type of grasp or pinch in order to, you know, turn the key, holding little small objects. It really can translate into everyday life.
Yeah, also like getting dressed, also handwriting.
Yeah.
And they'll do this like 10 times, and then we will move on to a different activity.
And using the same equipment or tools, one other thing that we wanted to work on is on finger opposition. So what I like about this block is kind of the same thing as the C-bar, is it helps to open up that web space. Mm-hmm. That's what all these are intended to do, helps to open up that web space. And also it's for, you know, strengthening. So here we work on finger opposition. So have them try to, they may not be able to squeeze as much as I would right now, but even if it's a little bit, try to each finger. Get them to be able to squeeze and be able to do that. We could grade this activity as well. We know this is the more soft material. We could switch to the cube, which is a little bit harder there. And as time progresses, we could even go to the ball, which creates like even wider, like spreads out that web space even wider than the foam in the cube. And it's also a little bit more resistant.
And it also, if you see what kind of grasp Leia is in right now, a cylindrical grasp. So it allows the individual to come from maybe like a 3-jaw chuck type of grasp into a more of a cylindrical grasp. It just allows that, you know, palm to open up a little bit more and extend that web space out.
Yes, and all these activities help with just to increase just the dexterity with your finger dexterity. Like we said before, just helping you to be able to have more power grasp, power grip, and just be able to pick up fine motor skills, just to be able to strengthen those muscles in order to do those activities.
Yeah, and part of our problem list with some individuals with ape hands is those prehension patterns. And so this, by using these small objects in hand manipulation, and will increase the prehension patterns and manual dexterity.
Mm-hmm.